trust and this responsibility that you are giving us. I think I can confidently say that on behalf of the other members of the committee that we accept this responsibility and we promise to deliver to the best of our ability to help us all. The Medical Advisory Committee is not something that is new. For some of us that have either trained or worked in other hospitals, especially tertiary hospitals, we must have heard of the MAC, that is the Medical Advisory Committee. We also would have heard about CMAC, especially in federal teaching hospitals. Why is it important for us here, the Medical Advisory Committee? I want to use this opportunity to just briefly say something so that we actually understand why we are all here. And for us to also understand that it is not just about just having a committee. Now, I used to summarize the hospital this way. I used to tell people that in the hospital, we have two kinds of people. We have the staff, which puts, what will I say, the responsibility of delivering their job and everything falls, of course, under the medical director through the head of admin. Then we also have the other category of people in the hospital, which are the patients and their relatives. Now, whether we like it or not, everybody, the staff, the relatives, and everybody is in this hospital, is working or is coming to this hospital because of these patients. I don't know whether that fact is true. Everybody is here because of these patients. That is one. Fact number two is that when this patient comes, you now discover that there is no singular person that that can solve the person's problem, the patient's problem. I don't know if I know people say people usually say Nazorenin Likita. But how can you see the Likita until the security directs you, until the nurse confirms that you're even actually supposed to be in that particular place or not, until you are properly documented through the medical records, right? But you have your medical, what do you call it, your vital signs sorted out. And then by the time the doctor sees you, he tells you that it's not finished, or your problem is not finished, or your solution is yet at hand. You need to go to the lab, you need to go to the pharmacy, you need to go to, so many things like that. So you now realize that at least you must have touched 3 or more places or units in the hospital, and if eventually you are to be operated, you have to go to the theater, you have to be admitted, the nurse handles that, you have to go to physiotherapy, and so many things like that. So, that is just one aspect. And so you now find out that, unfortunately, in Nigeria, I know that in the past, when I became a doctor, things have actually changed. You now realize that in clinical practice now, everybody is actually trying to, is it territorialism, I will call it, the way animals do. When the lion comes, he doesn't want to see any other partaking in that particular territory that is actually controlling. Some people say, is it because of unionism, or is it because of an awakening, or is it because of anything? But in the end, it is the patient that suffers. And then you find a lot of situations where you want to actually solve this particular problem of this patient, but you have a bottleneck. What is the bottleneck? Everybody is trying to protect the stuff. The nurse will tell you, this is my territory, I own the patient. The doctor will tell you, I own the patient. So there are a lot of dramas. This is aside from the lot of dramas that we also face between staff to staff, and then staff to patients. For example, you find where you have altercation between the doctor and the nurse, or the nurse and the pharmacist, and the lab scientist, and so on and so forth. So that you find out that there is chaos, and then in the end, the whole aim of hospital care or service delivery in the hospital, which is meant to be teamwork. That is the fact number 2 that I mentioned earlier. We have actually put it aside. And now we are thinking as if by being a doctor, I'm the solution to this person's problem, or by being a nurse, I'm the solution, or by being a pharmacist, I am the solution. That is the purpose of this committee. Where, as you can see, what is peculiar about the members of the committee, you can see that as long as you are a health worker, your boss is here. So that anything that has to do with patient care, any problem that may arise from any of the units or any of the specialty or profession, or any problem that may arise between a staff in one profession with another staff in another profession, or anything that has to do with training of any of the staff, or anything that has to do with even discipline. For example, if they say you have done something wrong, there are several cases where you see patient relatives coming into the hospital with their lawyers or their relatives, accusing staff of doing something wrong, of mismanaging their patients. And then, in the end, the top management will have to sort out the issue correctly, give you the appropriate punishment, sometimes correctly, sometimes it may not be correctly. We feel that if anybody says you have done something wrong concerning your service to that particular patient, there has to be a committee comprising of somebody that knows almost everything that you know, so that he can vet and then will inform the management that this person, from what that is from what is being accused of, professionally, we don't see that, we don't think that he has done, or we think that this is how he has faulted, and to what degree that he has faulted. So you can see that it touches everything concerning your welfare, concerning your discipline, concerning even how you work. So that anything henceforth that comes up, we are not going to be treating our issues like we used to treat it in the past, where you think that anything nursing is strictly for head of nursing, or anything doctors is for head of clinics, or anything pharmacists is for the head of the pharmaceutical services. No, we are going to be working together as a team. That is why we have this committee. So if we are together as a committee, there's no reason why the staff working under us and not work together and do things together. Basically, summary, that is the whole essence, very simple terms, why you have the medical advisory committee in any hospital. Thank you very much.
Thank you very much. I think in the absence of any announcement, any query, I want to join this meeting. In the next 2 weeks, where are the committee members? Let me not. Do we have any other presentation the next week or next 2 weeks?
Yes.
Next 2 weeks. Join the cities and the departments to do the presentation, and the topic to be presented will be communicated in due course.